Fertility awareness methods come in several forms: the standard days method, the symptothermal method, and the 2-day method, which this presentation will cover. The 2-day method is used in determining fertility based on body signs. Women are to monitor their cervical and vaginal secretions on a daily basis. The 2-day method is a replacement of the old cervical mucus method. And based on some research that I did, they are essentially the same thing. It's the prediction of ovulation is based on the mucus collected in the cervix and vagina, and the quality and quantity of the mucus changes just before ovulation. How will you know if you're fertile? According to contracept.org, when a woman experiences the proper cervical and vaginal secretions 2 days in a row, it indicates that she is fertile. Women who do not want to become pregnant should avoid intercourse during this time, whereas women who wish to become pregnant should engage in intercourse. It's recommended that women attend courses and training to understand what they should be looking for on a daily basis if they choose to follow the 2-day method. If you attend recommended courses, you will learn the way that the secretions should look and feel. If the vaginal secretions are sticky, it is likely that ovulation is not occurring. If the vaginal secretions are creamy and white, it is likely that ovulation is approaching. If the vaginal secretions are slippery and stretchy, it is likely that ovulation is occurring soon. Secretions liquefy and flow around the time of ovulation. If you are taking contraceptives, your secretion pattern may not be as follows. There are qualifications for those who wish to implement the 2-day method. First of all, as previously stated, women who are using contraceptives are not really recommended to try the 2-day method due to the altered secretion patterns. And the 2-day method is recommended for women who experience menstrual cycles that are longer than 26 days and that are shorter than 32 days. Advantages to the 2-day method are it's low to no cost. All you might have to pay for is a training course. There are no side effects, and it's readily available. There are disadvantages to using the 2-day method. There's a lack of fertile days. There's no STD protection. There may be a lack of cooperation among your male partner. It is not suitable for those who have cycles shorter than 26 days or longer than 32 days. And the failure rate can be up to 24% according to ARHP.com. Why or why not to choose the 2-day method? As we already spoke about in the advantages, with the 2-day method there's virtually no side effects. It's readily available and it's inexpensive. Also, you can increase the knowledge about the physiology and reproductive aspects of your own body, and it's effective when it is done correctly. As we already spoke about in the disadvantages, there's a lack of fertile days. There's no STI protection. There may be a lack of cooperation among your male partner. It's time-consuming because it requires careful daily monitoring. It may not be suitable for you if you have an irregular cycle, like one lasting longer than 32 days or one shorter than 26 days, and it can fail if it's not done correctly. If I had a friend trying to become pregnant using the 2-day method, I would encourage them to, first of all, make sure their partner's on board with the concept, and then to get the education necessary before starting the process. I would encourage them to check for secretions at the same time every day, and then I would also tell them to keep a written journal or document what they find each day to make it easier to determine ovulation.